You know, if I'm being honest, I just like hanging out with people. Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 253, and today I want to talk to you guys about why I have 2-hour-long consultations with new patients who come into my clinic. But before I get into this video, do me a huge favor, click the like button, really helps out the channel. And if you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It is greatly appreciated. So, a lot of you out there may feel like an hour-long consultation is normal, or that a 15-minute consultation is normal, or that a 3-hour-long consultation is normal. But let me give you some insight as to why when people come and see me in my clinic at Applied Hearing Solutions in Phoenix, Arizona, well, both myself and all of my other providers do a 2-hour-long consultation for new patients who come into the clinic. So, my upbringing through school and through the training that I had gone through, and then ultimately when I first started my clinic, there was a variety of different times that you would have to do a consultation with a patient. So, and it really depends on the environment that you're in as well. So when I was in school, we had an hour-long consultation time with a patient. So someone would come in, we'd sit down with them for a few minutes, go through a case history, do some testing on them, review the testing with them, tell them if they did or did not need hearing aids, and then tell them or get them scheduled to come in for their hearing aid fitting sequence, okay? I then ended up going through an ENT rotation, and the consultations for an ENT clinic were like 15 minutes, or I guess I should say anywhere between 5 and 15 minutes. So a lot of these individuals have had their hearing testing done already. The case history was already done by either the audiologist or the ENT physician. And so really the only thing that you're doing there in that 5 to 15 minute window is saying, hey, you need hearing aids, you have hearing loss, we need to get you in, here's what your options are. And you basically get to pick from whatever hearing aid options that they give you, or maybe they'll give you a recommendation for one particular one, but they do not have a lot of time to kind of explain the ins and outs of the entire treatment process, nor do they have the time to explain all the different feature and technological aspects of different hearing aids. You're basically going in, here's the recommendation, do you want to do it, do you not want to do it, let's get you scheduled, okay? Now, when you go into more of a private practice setting, you're usually going to get between an hour and an hour and a half long consultation time. And this is to account for them having you come in, doing full case history, identify what things are important to you, what areas you're struggling in from a hearing perspective, go through your testing, review all the testing with you, and then give you a recommendation after they review all of the different options that you have from a hearing aid perspective that would ultimately solve whatever the difficulties that you're having. Now, when you go through, training for all of this, it really just depends on how long your clinic gives you to do these things. So you can go through a consultation in an hour, you can go through it in an hour and a half, you can go through it in 2 hours. But the reason why we now use a 2-hour initial consultation time inside of my clinic is to make sure that we do not have to rush at all when we're trying to identify case history information, priorities that you have, as well as identifying the perfect hearing aids for you, and then being able to explain the process that we're ultimately going to take you through with those devices. And then on top of that, we do a lot of custom products inside of my clinic, which means it takes extra time to do 3D ear scans and things of that nature. So we do not want to run out of time with patients. When I first opened up the clinic back in 2017, because I was trained on an hour and a half long consultation, that is how long I scheduled my consults for. But I started noticing that I wanted to explain more to my patients. I wanted to take more time to identify what was important to them. I wanted to make sure that I had plenty of time to do a really high quality ear impression, if that's what I needed to do for a particular patient, and I wanted plenty of time to explain to them what the treatment process was ultimately going to look like, okay? And so once I, was about a year or two in, I'm like, golly, I feel like I'm rushing some of this stuff. I want my patients to be really well informed by the time they leave my clinic, and trying to do all of that in an hour and a half when you consider that a hearing test, a good hearing test that follows best practices, meaning you're doing speech and noise testing, you're doing UCLs, all of these other tests that you wouldn't typically get in a regular hearing test, that takes about a half hour to do if you're going to do it really, really well. You also need to think about spending at least a half hour doing the case history and then identifying all of the things that are important to an individual from a hearing perspective, because that is the information that you're going to use when you then provide them a recommendation for treatment. There's a variety of examples that I could give on this, but let's say if the most important thing to them based on identifying their wants and needs is going to a public venue to hear like a Broadway show better, when I get to my recommendation of hearing aid technology, I had better be considering a telecoil and or Bluetooth LE audio that has Auracast capabilities in those devices. Because otherwise, I'm going to send them back into this environment that's most important for them, and they're not going to have hearing aid technology that can do the things that they want it to do, okay? And like I said, there is so many cases of different things that are important maybe to you that are not important to someone else, and then when we're making a recommendation for hearing aid, we have to take all that into account. So, you're spending about a half hour on the front end from a case history and identification of specific wants and needs. You're spending a half hour on the best practice hearing testing, including speech and noise testing, UCLs, all that stuff. Then you have to explain the results that they got on the hearing test in relation to all the areas that they're having difficulties in, so they can actually understand, oh, okay, that difficulty that I'm having is because of this that I had done on the test. And so it kind of makes it tangible for people to understand really on a deep level what their hearing test is showing us, not just from hearing in quiet, but also hearing in background noise. Once we're done with that, so then we're about hour and a half in at this point, because you're spending 30 minutes, case history, identification of what their important needs are, 30 minutes on testing, 30 minutes to help them understand their hearing test. And now we've got 30 minutes to explain the hearing aids, why we're picking certain hearing aids, what the features are that are important to the individual, and then ultimately potentially doing a custom ear mold impression or 3D impression, 3D scans of an ear canal, and even explaining what the process is going to be from a fitting perspective. So unless you want to significantly shorten all the times that you take to do all of those things, it really takes, to do it at a high level, in my opinion, around 2 hours to make sure that we don't miss anything and to make sure that when someone leaves our office, they actually have an understanding of what's going to happen. I don't like when I'm rushed. I'm the type of person who likes to get stuff done fast. But at the same time, hearing is so important that you need to make sure that not just as a hearing care professional, you have a full understanding of what your patient's wants and needs are and what you're going to do to solve that problem, but you want them to have a good understanding of what their wants and needs are and what you're going to do to solve the problem for them. I would say really that the two negatives of having a 2-hour-long consultation time is that it limits the amount of patients that we can ultimately see in a day, because if you're having a couple of consultations a day, that chews up at least half of your day, and then you only have half of your day to do all of the other treatments that you need to do with your patients. The other side of this is that we have to charge for our time, because in order to spend this much time with an individual, that is time that we could be spending doing other revenue generating things. So while a lot of clinics will give you a free hearing test and have you come in for 30 minutes to an hour and just do it really quickly, and then hopefully you purchase hearing aids from them to cover the cost of that time, we don't like having treatment be dependent on, or rather, I don't like the idea that your consultation payment is dependent on whether or not you purchase hearing aids. You're going to walk away with a ton of value one way or the other, regardless of whether you purchase hearing aids from our clinic, but you're going to have to pay for that time. So not only are you going to have to spend more of time out of your day when you come into my clinic, you're also going to have to spend some more money out of pocket for all of that consultation time that is above and beyond what the industry standard is. So what am I saying? Well, basically I'm saying that my clinic is focused 100% on a high-level experience inside of the clinic for patients who come to see us. Can you get a high-level experience at a shorter duration amount of time for a consultation? Absolutely you can. I'm sure that there's providers out there who are much more clear and articulate and explain things much easier than what I explain them inside of my clinic, and they can do all that in a shorter amount of time, and you still walk away with a ton of information, a ton of knowledge, and knowing that they're the right clinic for you. We are just not at that point where we can essentially take 2 hours worth of information sharing back and forth and compress that down into 60 minutes. And again, we had to make a decision, what do we want to do? Do we want to be more efficient and cost savings for patients, or do we want to be more comprehensive and just have to charge a little bit more money to be able to do it? And we picked option number 2. So if you're an individual who is going to be coming into my clinic, do not be shocked that we take 2 hours at that initial consultation to do all of the consulting and all of the hearing testing. And do not be shocked if you actually have to pay for your consultation when you come into Applied Hearing Solutions, whereas other clinics will give you this consultation for free.